Assalamualaikum. My name is Anwar with Ahmad Redzuan. Inshallah, I will present about introduction of the selected newspaper representation. In a compelling call to action, Bandar Kuching MP Dr. Kelvin Yee has championed the cause of fair wages for healthcare workers in Malaysia, emphasizing that they deserve more than just words of appreciation. Dr. Yee's impassioned plea comes on the heels of a decade-long salary review hiatus for healthcare professionals, during which time the burdens on these dedicated individuals have only grown. He has proposed a practical solution to channel funds the dire state of healthcare facilities characterized by understaffing and overburdened healthcare workers. This call for fair pay not merely a matter.
Assalamualaikum warahmatullahi wabarakatuh. My name is Athirah Binti Zakaria. The primary issue in the article is the allocation of funds collected from purpose excise duties on e-cigarettes or vape liquids containing nicotine. Bandar Kuching MP Dr. Kelvin Yee is advocating for these funds to be utilized towards providing fair wages for healthcare workers. This stems from concerns that healthcare workers have not received a salary review in nearly a decade, leading to burnout, low morale, and workforce shortage. Dr. Yee also suggests that a portion of these funds should be directed towards reinforcing primary care and addressing non-communicable diseases, which are a growing concern in Malaysia. Additionally, the article highlights the needs for proper management and allocation of resources within the healthcare system and the importance of reducing wasteful spending.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Usyair Iman and I will present to you about the implication from the provided article. There are two implications that stand out that were provided by the article. Number one is healthcare worker retention and fair compensation. The foremost implication revolve around the retention of healthcare workers and the urgent need for the fair compensations. The data reflects a concerning trend where a significant portion of the government healthcare workers contemplate to leaving their positions due to various issues like immense work, burdens, understaffing, and unfair pay. The implication here is to immediate the necessity to address these concerns to retain skilled professionals in the healthcare sector. Other than that, allocating the funds from the proposed excise duties on e-cigarettes or vape liquids towards fair wages for healthcare workers become a crucial step in boosting the morale and ensuring workforce stability. This aims not to acknowledge the contribution to prevent a potential healthcare crisis due to exodus of professionals, especially amidst the ongoing challenge posed by COVID-19 endemic. The second implication is emphasized on preventative healthcare and structural reforms. Another significant implication involves the need for a shift in healthcare focus towards preventative care and structural reforms. Dr. Yee's proposal highlights that the importance of prioritizing preventative and primary care over curative services. The article emphasized that despite increased allocation in the budget, the focus remains largely on the curative care, redirecting funds toward preventative measures such as vaccination programs and measures to address the non-communicable disease (NCDs) become imperative to alleviate the future healthcare burdens. Additionally, the emphasis on the structural reforms within the healthcare system indicates a need for more comprehensive changes beyond operationals and capital expenditure. Allocating a larger budget for this reform, especially to address fundamental issues like health financing, human resource, and service delivery organizations, would pave the way for a more sustainable and efficient healthcare system. Overall, The implication highlights that the critical needs for the immediate actions to retain the healthcare workers, ensure fair compensations, and strategically to allocate the resources to prioritize preventative healthcare measures and structural reforms for a more resilient and effective healthcare systems in Malaysia. That's all for me. Assalamualaikum warahmatullahi wabarakatuh.
Hi, Assalamualaikum. My name is Siti Athirah Binti Wahab, and for my part, I will talk about the suggestion. Okay, for the first suggestion that we can get from the article is the authority need to truly focus on prevention and primary care. Next, the allocating resources, especially in the area of tax relief, is a crucial component of the 2023 budget if prevention and primary care are to be generally prioritized. Although the budget increased the tax exemption for prescription drug costs, is it imperative to shift the focus by improving the incentive for preventive treatments? For example, the 8,000 cap on expenses for curative treatment is far larger than the present vaccination-related tax relief cap of 1,000. So in order to address this disparity and emphasize the need of preventative care, a prudent course of action would be to gradually increase the annual tax deductions cap for vaccination service from 2024 to 2029. So this gradual strategy not only demonstrates a persistent dedication to public health but also recognize the long-term advantage of proactive healthcare strategy. Okay, next, for the second suggestion is the authority should focus on and allocate a larger amount of funds for structural reform, not just for operating expenses and capital expenditure, because while the Ministry of Health has been allocated 36.3 billion, we should instead shift our attentions to substantial structural reform in healthcare rather than just funding for operation and capital project. It means that structural reform entails the addressing foundation aspect of the healthcare system, such as improving efficiency, upgrading the technology, and enhancing overall resilience. By advocating for a larger allocation towards this reform, the goal is to ensure the long-term sustainability and adaptability of the healthcare system. It is clear that strengthening our healthcare system requires a significant increase in funds for fundamental improvements. So by advocating for a substantial increase in fund, the aim is to create a healthcare system that can withstand the unforeseen challenge and evolving public health needs. So that's it from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Balqis Binti Yahaya. Now I will do further explanation of the suggestion on this article. The third suggestion is the government shall introduce the control of tobacco product and smoking bill 2022. The MP of Sarawak called the bill a game changer. The control of tobacco product and smoking bill 2022 represent a significant legislative effort in order to address the evolving landscape of tobacco consumption, particularly with the emergence of e-smoking products. This comprehensive bill reflects the authorities' commitment in Kuching, Sarawak, in order to safeguard public health, regulate the tobacco industry, and respond effectively to the challenges posed by electronic cigarettes. Suggestions are regulations of tobacco products, protection of minors, and public smoking restrictions. Regulation of tobacco products, which the legislation articulates specific regulations governing the manufacturing, packaging, labeling, and sale of traditional tobacco products. It encompasses measures aimed at curbing the adverse health effects associated with smoking, including stringent guidelines for health warnings, restriction on advertising, and standard for product quality and safety. Next, protection of minors. A pivotal aspect of the bill is the prohibition of sales to the minors. Recognizing the vulnerability of the youth to the addictive nature of nicotine, the legislation imposes strict age restriction on the purchase of tobacco products, including the e-cigarettes. Additionally, robust age verification mechanisms are established to ensure compliance with these provisions. Lastly, public smoking restrictions. The bill addresses the imperative to protect non-smokers from the harmful effects of second-hand smoke. It delineates comprehensive restriction on smoking in public spaces, both indoors and outdoors, by establishing clear guidelines for designated smoking areas and implementing stringent penalties for the non-compliance. The legislation seeks to create a healthier and safer environment for all residents. Next and last point, focusing on MOF and JKR. Establishing a task force comprising not only the MOH but also other agencies such as the MOF and Public Work Department, JKR. This task force will identify the priority and necessity of health facilities and closely monitor all development expenses and procurement processes. In the pursuit of enhancing healthcare infrastructure, it is imperative to establish a collaborative task force that transcends the confines of the Ministry of Health, MOH. This proposed task force, involving not only the MOH but also other key agencies such as the Ministry of Finance, MOF, and the Public Works Department, JKR, in order to aim to streamline the identification, prioritization, and implementation of crucial health facilities. By closely monitoring development expenses and procurement processes, this task force seeks to ensure transparency, efficiency, and optimal resource allocation in the pursuit of robust healthcare infrastructure. Collaborative task force compositions. The task force will bring together experts and stakeholders from various relevant domains, combining the expertise of the MOH, MOF, and JKR. This collaborative approach harnesses the diverse skills and knowledge required for comprehensive decision-making, ensuring that healthcare infrastructure protects aligned with both health priorities and fiscal responsibilities. Next, identification of priority health facilities. The task force's first responsibility is to identify and prioritize health facilities based on critical factors such as population health needs, regional disparities, and existing healthcare gaps. By engaging the MOH, the agency primarily responsible for healthcare, the task force ensures that identified facilities align with public health goals and strategies. Lastly, monitoring development expenses. Transparency and accountability in the allocation of resources are fundamental to the success of any infrastructure development initiatives. The task force, with the inclusion of the MOF, plays a pivotal role in closely monitoring development expenses. Through rigorous oversight, it ensures that financial resources are allocated judicially and in accordance with established budgetary constraints. That's all from me, thank you, and I'll pass to the next presenter.
Lastly, we go to the conclusion. Dr. Kelvin Yee's passionate appeal for fair wages and support for healthcare workers in Malaysia is a clarion call that resonates with the collective conscience of a nation. His proposition to utilize funds generated from excise duties on cigarettes for the betterment of healthcare workers not only addresses a long-standing issue of wage stagnation, but also symbolizes a society's gratitude for the sacrifices made by its frontline heroes. As the healthcare system faces challenges such as understaffing and overworked professionals, this proposal embodies a crucial step towards recognizing the intrinsic value of these dedicated individuals and ensuring their welfare. That's all from us. Thank you. Assalamualaikum.